Welcome to our clinical sites virtual tour. Now let's take a look at Valley Medical Center. So Valley Medical Center is Washington's first public district hospital, founded back in 1947. It's a level 3 trauma center with a helipad on the roof. The new South Tower was built in 2010, and this is where the emergency department is. So we rotate down here 1 month each in our second, third, and fourth year, and we additionally do our OB rotation here. It's located down in Renton, which is just south of Seattle. It's in South King County. So we take care of a really diverse and vulnerable population in that region that's slightly different from the downtown Seattle population. And it's a really great place to practice the fundamentals of emergency medicine. So here at Valley, a little bit different than Harborview, you will be doing the initial stabilization of trauma patients, and then anything that is too complex will go up to Harborview, just up the road. Valley is also a thrombectomy capable certified stroke center, and our neurosurgeons share call at Valley with UW Medicine, and there's a really great transfer process between the two cases as Valley is under the UW umbrella. There's private rooms everywhere. It's very well staffed for nursing and support staff, and it's overall a fantastic place to work. We have a slightly different group of attendings here that are more community focused, and many of our attendings are actually alumni from our own program, which is fantastic to see. Here's an example of a private room, which, as you can see, is fairly spacious and nice. They all have their own TVs, which unfortunately we don't have at Harborview. Here's a view of one of the pods, and as you can see, each hospital has a different system for coronavirus and keeping track of PPE. Here they've made little backpacks that they hang, which is great. So we as residents like to call this our procedure heaven month, because anytime a sick patient comes in or a patient needs a reduction or a sedation or cardioversion, the attendings really like to have resident help, and in fact really want you to do the whole procedure, because that gives them time to go see more patients. So this is a place where not only do we get tons of procedures at UW and Harborview, but we kind of drown in them at Valley. I had a shift once where I had 5 central lines in a day, so you get pretty busy. The ICU will also sometimes call if they're overwhelmed and ask if there's an EM resident available to intubate or put in a central line or an arterial line. So it's a pretty fun place. The attending staff here is really fantastic as well, and they give us teaching a little bit more geared towards community medicine, as in billing, how to be more efficient, how to take care of patients who have really efficient follow-up, and what can be done as an inpatient versus an outpatient. Here we have our physician lounge, where you will have your own locker. There's a sleep room that you won't need because you chose the right field and have shift work, and you will not need to stay on call. We use iPhones, and you have your own private bathroom in the physician lounge. Now, Valley also has recess bays very similar to Harborview that are quite large and curtained off, that have all the bells and whistles to take care of sick patients. And while Valley is not a level 1 trauma center, you will see all of the trauma local to the area. So you will frequently stabilize trauma patients here and then transfer them up to Harborview for further specialist care such as ophthalmology or neurosurgery. All right, and last but not least, let's take a look at Seattle Children's, which is our dedicated pediatrics hospital. During our intern year, we spend an entire month here getting used to the system, as well it uses the same EMR, which is now Epic, woohoo. They do have a slightly different structure. And Seattle Children's is located just down the road from University of Washington, so our 3 main sites are all within 2 miles of each other, which is very convenient. So as we walk into the emergency departments, you get a look at the lovely Starbucks in the lobby, which is just a hint of how well most children's hospitals are funded. Here, we just have a couple shots walking around the emergency departments, looking at all of the private rooms and workstations. Here you can see one of our fellows, Siobhan, talking to one of our residents, Laura, and the Peds EM fellows rotate here and do a lot of teaching. So there are 38 patient rooms at Seattle Children's, and there are some flex areas as well, should you ever need to see more. So Seattle Children's is the tertiary pediatric care center in the area, so you will see pediatrics patients from all around the state and sometimes even Alaska. And just like at UW, we have video interpreters available for every room and lots of resources. Here at Children's, we actually have multiple in-person interpreters as well. Next, let's take a look at the resus rooms. Pediatric resuscitations, thankfully, are more rare than adult resuscitations, but Seattle Children's does have dedicated spaces for them, retrofitted for coronavirus, of course. And so not only do they have airway set up, they have the additional carts that are separated by Broslow size, and lots of resources to make it easy for you to take care of pediatric and tiny patients. Moving on, we have something called the just-in-time room. I'm not sure who named that, but to us that means simulation. So every day at lunch we will have teaching, which sometimes will focus on patient cases, other times we'll do procedures, and sometimes you will be the most knowledgeable about procedures in the room, so you can help do a little teaching at that point. All right, Seattle Children's is also nice because they have a 24/7 pharmacist in the emergency department who will be present and actually just shows up anytime a patient is sick, and will often do med reviews when you're not even paying attention and find that your patient is due for medications or that you under or overdose your patient on something. As with our other hospitals, we have dedicated ultrasound machines and teaching for every room, which is fantastic. Seattle Children's is also special because they have a dedicated critical care transport unit. So this is a team of nurses and paramedics who are specifically trained in pediatric ICU care and can take sick patients anywhere they need to go. And they work with our flight EMS system, Airlift, to get patients from various places in the state without pediatric resources to Seattle Children's, which means we get to see lots of sick patients. To add to our pediatric exposure, we have one conference per month dedicated to pediatric pathology and procedures, frequently incorporating simulation and procedure labs. The last best thing about Seattle Children, similar to many pediatrics hospitals, is that we are super well equipped with all the resources you could possibly think of to make life easier for scared pediatric patients, such as child life specialists, snacks, toys, bubbles, iPads, all sorts of distractions. Thank you for sticking with us for this virtual tour. We hope you enjoyed and got a sense of how it is to work in our various emergency departments. We hope to see you soon.